Wow, guys. So this is week 4. This is knowledge check number 3 for week 4. So we're going through more of the heart stuff, and there was some confusion on this one, and I don't blame you. I see what's going on, and this can be hard. Now remember, the heart is a pump that has 4 chambers, 2 atria at the top and 2 ventricles at the bottom. It has septum. Remember I talked about that right here, septum right down the middle. And so one side is basically the deoxygenated side, which gets blood from the body that has less oxygen, right, or more CO2, carbon dioxide, and pumps it to the lungs to drop off CO2, get rid of it, bring in oxygen. And it brings it oxygen, brings it to the left atrium, then to the left ventricle, and then out to the body. So this one right here is actually the Journey of Blood knowledge check. I kind of love this one. I always do this in all of my lecture classes because it's a really good one to get the whole thing. Now, there's songs you can look up on the interwebs and all kinds of different stuff like that, but we're going to go through it really quick, and I'm going to just show you exactly what the answers are. Pulmonary valve. So this one here, organize the anatomical structures in the correct order. So we're following the blood through the body. So imagine you're a little guy, you're sitting on one of them little red blood cells, and you're carrying some oxygen with you, and you're flying through the whole system. And you're starting with the blood entering the heart through the inferior and superior vena cava side, and ending with the exit to the aorta. So we're going through the heart. So we're coming in from the bottom, the inferior vena cava, from the bottom of the body through the diaphragm up into the heart, to the right atrium, and then it's going to go to the from the top of the body. So it's going to drain down into the right atrium from that top part. So we're going to go and find out which ones of these are. Number 1, inferior vena cava. I don't know if we do it. Yeah, there we go. Number 1 is going to be that one right there. Number 2 is going to be the right atrium. We talked about that one real quick. Then from the right atrium, does it have the valves? Yes, it does have the valves. And we're going to go through and find the tricuspid valve. Tricuspid means 3 parts. Okay, that's number 3, tricuspid. Bunk. There we go. Number 4, we're looking at, it goes from the atrium through the tricuspid into the right ventricle. For right ventricle. There, yes, we're still good for ventricle. And then number 5 is so after that it goes to the right ventricle. Right ventricle receives that blood, pumps it out, and it's got to get it to the lungs, so it's got to go through a pulmonary valve. Pulmonary. Oh man, not wanting me to accept it. There we go. 5. And number 6, the pulmonary artery, which goes, remember, arteries go away. Arteries go away from the heart. So it takes deoxygenated blood, atrium, through the tricuspid, into the ventricle, out through the pulmonary vein or pulmonary valve, out through the pulmonary arteries to the lungs, drop off CO2, pick up oxygen, come back through the pulmonary veins. That should be the next one. Where's number 7? Yes, pulmonary veins right there. Beep, beep, beep. Goes from there. That's the pulmonary veins. It's going to go to the left atrium now. Where is left atrium? Number 8 is left atrium. There we go. Yes, we're still good. Left atrium is going to go through the mitral valve or bicuspid valve. That's right there. Good. And then the last one, the left ventricle, and then aorta. Bada bing. Let's check it. See what happened. Bada bing, bada boom. We're good. Now you can go back and recycle that one. I want to do this in less than 10 minutes, but let's see what happens. Let's see. Is there more on that one? That's the whole thing. Well, there we go. 4 minutes. So go through those. If you need to do it again, you're fine for doing it again. I know this is going to be really confusing, and the heart is a hard one. Now, some of you are going to get into stuff with the heart. You're going to learn how to take blood pressure, and you're going to learn how to listen to the heart and find the different pulses, right? The radial pulse, the carotid pulse. You can do axillary in the armpit. You can do inguinal in the groin down there. You can even do dorsal pedal on top of the foot. But for these, we want to like just start to work on understanding a little bit of the flow. You're not going to be, you're not a cardiologist yet, so you're working towards there, right? Now, I've been having a lot of experience with this stuff because I had a heart issue and I've had some stents put in, and I'm listening to my heart all the freaking time. Put that one down there. And of course, my phone always interrupts me when I'm doing these videos. Anyway, good luck, you guys. This is week 4. I'm giving the answers today. It's Friday. So I want you to kind of go through this if you need to and redo it if you have to. And then you might want to even get a little drawing of the heart and draw it out and just see if you can draw it if you really want to understand it a little better. I love drawing stuff. I wish we did more of it in here, but we don't. And that's that. We're going to do 5 minutes and we're done for today. You guys, good luck. We'll talk to you soon. Bye.